Everyone, welcome to the Joint Conference Committee meeting for the Laguna Honda Hospital for August 8th, 2023. I have a short announcement. Oh, let me have the order. Yeah.
Do the roll and then we'll go to that. Commissioner, I'll start with you, Commissioner Guillermo.
Present.
Commissioner Green.
Present.
And Commissioner Chow.
Present.
Okay, I have a quick announcement to make before we continue. Surveyors arrived at Laguna Honda this morning, and Laguna Honda leaders and staff are actually all thoroughly engaged in this regulatory work this afternoon. As a result, we're going to be removing open session items. Number 4, the executive team report. Number 5, hiring and vacancy report. And number 6, regulatory affairs report. And in closed session, we will remove the medical quality improvement report. And I'll ask Mr. Morwitz to continue with.
Yes, and if any of you planned on making public comment about any of the items that have been removed, you may use your 3 minutes in general public comment to make comment on those items. No extra time will be given during general public comment to any individual to make comment about any other item that's been removed. Thanks for your patience and flexibility. I will now read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, which is the approval of the July 11, 2023 minutes.
Okay, thank you. You have the minutes in front of you. Committee members, if I can have a motion to approve.
So moved.
Second.
Okay, public comment.
Yes, folks in the line, if you'd like to make public comment on this item, we will start with those who have received accommodation. If you've received accommodation from me and would like to make comment, please raise your hand. I see a comment. All right. The person who raised their hand, would you? Oh, yes. Are you there, caller? You're unmuted.
Hello, it's Patrick. Can you hear me?
Yes, Mr. Manetschall, please begin. This is for the minutes.
I know. The July 11th minutes report my concerns about the Moss Adams, quote-unquote, Hoshin Connery, end quote, $10 million contract, which wasn't presented during that meeting on July 11th. The Commission's Finance and Planning Committee approved on April 4th amending a Moss Adams contract, including allocating $4.1 million for the Laguna Honda portion of this consulting gig, but $3.3 million in expenses weren't apportioned to specific named projects. Laguna Honda's portion could therefore be higher. The amendment service description said the contract would remediate all plans of correction, including all root cause analysis reports and action plan milestones. That's duplicative consulting to HSAG's contract. Why does Laguna Honda need 2 consulting firms to develop documents that were to be prepared by the Laguna Honda's quality improvement expert? So 5 JCC meetings later, you still haven't been briefed on this contract since your during April, May, June, July, and now August meetings. There's been no opportunity for members of the public or members of the JCC to learn about this contract. Was that contract so embarrassing that it hasn't been presented to the JCC? Do you guys really need an air traffic control system to handle communications among the so-called uh, coincident command structure. Why haven't you gotten an update, and when will you on that contract? Thank you.
All right, that is the only hand I see on this item.
Okay, we have a motion and a second. All those in favor, say aye. Thank you.
All right, the item passes.
Move on to general public comment.
Yes, item 3 is general public comment, and again, members of the public note that items 4, 5, and 6 are not going to be discussed today, so if you'd like to make comment about any of those items, you may do so during the general public comment time. You will, again, not receive any more than 3 minutes per person. If you would like to make comment and you've received accommodation, we'll start with those folks first. Mr. Manette-Shaw, please begin.
Hi, this is Dr. Palmer.
Oh, I'm sorry, Dr. Palmer. I apologize.
That's okay. I'm WW. Yeah. I had a comment on the executive report. I wrote to you. I asked that that be put in the minutes wherever it belongs, since there was this last-minute change in the agenda. But my big worries are that the state was supposed to submit a July 31st closure and eviction plan with a regional plan for evicting and getting rid of Laguna Honda patients. And where is that plan and what is in it? And does anyone in the health department know anything about it? And how can we find out about what's in it? The other thing is, it sounds like y'all are making a good faith effort to be recertification ready by September 1, but I don't understand what that means. Does that mean you will apply for recertification by September 1? Does that mean that September 19th evictions and closures will go forward anyways, and which will be deadly? And when will we, what is the time frame or any approximate guess as to when Laguna Honda can start readmitting? Those are my major worries, and the written comment is more detailed. I'd appreciate if you put it in the minutes, and I'd really like to get these questions answered. This is going on and on. If you don't know anything, at least say you don't know anything, but let us know what we're up against, please. Thank you.
Thank you. I see no other hands. I'm going to call again. This is general public comment. Your one chance to comment on items not on the agenda and those items that have been deleted, including the executive team report, hiring and vacancy report, and regulatory affairs report. Okay, I see one more hand.
Yeah,
I apologize, Mr. Manette-Shaw.
No, that's me again.
Oh, I'm sorry. Sorry, the WebEx is jumping around. I very much apologize. As I'm pressing a button, the numbers are bouncing. Okay, here we go. Mr. Manette-Shaw?
Yeah, I'm here. Okay. Can you hear me okay now?
Yes, I apologize. Yes, please begin.
No need to apologize. I'm going to give my planned remarks for the executive team report here during public comment. On page 3 of the report posted online, had indicated that the planned goal of submitting Laguna Honda's recertification application went from a generic, quote, in the summer, end quote, to now, quote, the end of the summer, end quote. Why aren't DPH and Laguna Honda supplying the JCC with a more precise date on when that application will be submitted? And why has it slipped to being, quote, at the end of the summer, end quote? I just got a records response today from DPH claiming that CMS has still not approved the action plan milestones for reports, root cause analysis reports number 5 and 6, which were from surveys conducted between June 5th and June 9th, and then 3 surveys or 3 inspections on March 13th and March 17th, and then again on April 4th and April 19th. Because CMS has not approved those action plan milestones, how can you conceivably be planning to submit the recertification application in September if they haven't approved those milestones to those 2 reports? Under full transparency, this JCC should release publicly the closure plan CDPH was going to submit by July 31st, installing a state-led response team and a state-hired management team to be installed at Laguna Honda. I don't see how you guys can be planning to submit that application before September 1st if the milestones haven't been approved yet. And what does that portend for resumption of evictions starting on September 19th, because things are so far delayed? You should tell us again why the state showed up today and how that could possibly have affected.
Your time is up, Mr. Minetchell. Thank you. Okay, those are the only 2 hands I see. I'm going to call out one more time. General public comment. Any of the items on the agenda that were deleted? This is your time. All right. I'm noting again that items 4, 5, and 6 will not be discussed today, so we move right on to item 7, which is the action item, the Laguna Honda hospital policies. Commissioners, Dr. Baba is going to bring some responses to your questions right now. I just received them, but you may begin. Lucy, I'm not sure if you want to present or just take questions, so please begin.
Sure. Good afternoon, Commissioners. My name is Lucia Angel. I'm the Acting Chief of Staff for the CEO and NHA, and I'm covering for Carmen, who's out this week. But we have 36 policies and procedures to present today. One policy was a revision from the last JCC. That's a 2001 admission to Laguna Honda acute and SNF services and relocation between Laguna Honda SNF units. 48 were hospital-wide, 1 new, the 2014 absence and bed hold related to action item, then 46 revisions. Not sure if you need me to go through all of them. In addition, we have 1 deletion, the 7513 inpatient patients in custody. In addition to that, we have 14 departmental policies. 3 were deletions from outpatient clinic, 1 new from our FNS department, 8 revisions from our nursing department, 1 revision from our pharmacy department, 1 revision for our medical services. And I'm happy to collect questions and I can bring them back to the team for answering.
Okay, thank you, Lucia. I know that we were able to receive, as usual, the packet of the policies, proposed policies in advance, and there are a number of questions and comments that were made by members of the JCC awaiting response from staff, which is that what Navina is going to be?
Right.
Okay.
Yes, we'll be distributing to you, but before we do that, can we take public comment? That will also give you a little time.
Right, okay. So while we're waiting, in any case, if we can have any public comment.
Sure. So folks on the line, we are again on item 7, Laguna Honda hospital policies. There's only 2 people who have received accommodation for a disability, and I see 3 hands. So if the folks who have received accommodations will be prioritized first, I'll unmute, and each of you have 3 minutes. Hi, caller, please let us know that you're there.
It's Patrick. Can you hear me, Mark?
Yes, please begin.
Although there has been some progress made in revising the admission policy number 20-01, it's still problematic. Prioritizing the quote-unquote flow of behavioral health patients from SFGH is a higher priority than disabled and elderly San Franciscans languishing in out-of-county and non-medical facilities who are prevented from receiving skilled nursing care in their own community at Laguna Honda is obscene. San Franciscans dumped out of county or are in non-medical facilities who require SNF level of care at Laguna Honda should be granted admissions priority over people being cared for safely at SFGH. Obviously, Laguna Honda residents who were evicted out of county to out-of-county medical and nursing facilities following Laguna Honda's decertification should receive priority to return via repatriation to our county. It's humane not to do so. Laguna Honda census as of July 22nd was 496 people. When admissions can resume, the Health Commission must mandate Laguna Honda managers rapidly repopulate Laguna Honda to 700 pages through an aggressive repatriation outreach program. This JCC should require that Ms. Sandra Simon submit a repatriation plan for this JCC's consideration at your September 12th meeting in open session. Thank you.
Thank you, Mr. Minette-Shaw. Okay, we have a few more folks. Again, we're on those who've received accommodation. Hi, caller, please.
Yeah, this is Dr. Palmer, WW. I also disagree with the priorities in file 2001 hospital-wide. It's page 3 and 4 of 16. Second priority is patients at San Francisco General qualifying for SNF level of care over and above out-of-county San Franciscans at non-SNF at medical facilities and SNF facilities and overall other San Franciscans at other medical facilities that are not SNF facilities that need skilled nursing home care. It seems to me that a second priority should be anyone not in a medical facility who does need SNF care, if they're a San Francisco resident, no matter where they are, because as we know, people do not stay safe outside of a SNF. They can quickly change if they're not getting full SNF care and they're medically complex. Third priority should be all patients in medical facilities, any San Francisco resident anywhere, it seems to me should have equal access to Laguna Honda based on their individual need and not based on whether they're at San Francisco General or another hospital. We know that private facilities do not take Medi-Cal patients, and people get discharged to out-of-county facilities to give poor care or get discharged inappropriately to non-medical facilities if they are not given access to Laguna Honda. We know that there are people in the community who have been waiting for years and years and years to get into Laguna Honda, that you do have a waiting list. You should publicize it. And I know when I applied for my own mother to get into Laguna Honda, I was discouraged. I was told we have very few beds. It's going to be a long wait, blah, blah, blah. My mother was eligible. She needed to be at a nursing home, and she would have benefited from being at Laguna Honda. This is a dangerous situation for our aging population. And the health department also needs to work assertively with medical providers and long-term care providers to increase the number of long-term care beds in San Francisco, so we're not pitting communities in need against each other. But meanwhile, the people of San Francisco who need to be in Laguna Honda, it should be an equal playing field. Thank you very much.
Thank you for your comment. All right, we have one more. Caller, you're unmuted. Please let us know that you're there.
Good afternoon. My name is Susan Englander. I'm a former nurse, and I am currently on the board of the Harvey Milk LGBTQ Democratic Club. The club has taken on Laguna Honda as a significant issue because residency at Laguna Honda is an LGBTQ issue, as evidenced by the fact that a few of our members, friends, and community members have gone to Laguna Honda, have received solid care, and have died under your care comfortably and with dignity. We want that to continue. I agree with the last two callers that Smith should be the highest priority of Laguna Honda Hospital. I also acknowledge that you will probably not give up the flow-through admissions policy. I believe that with this policy in place, there has not been proper training of staff at Laguna Honda to accommodate and to care for this other patient population. I demand that this training take place because certainly it has been clear that these new clients, residents, patients are not being properly cared for, and this has an impact on the entire facility because this is what we're going through right now. Mental health and drug-addicted people also deserve care. They deserve proper care. They deserve proper boundaries and proper rights. And I do not see that happening right now in Laguna Honda. As a former RN, I find this very painful. I find it painful to see such a premier facility decline as I am watching it, and that it will possibly close, evict people without a current plan, and scatter these folks who knows where because their ability to pay is only through Medi-Cal, which is not accepted by many long-term care facilities. So this whole mess to our club is a cluster mess affecting the public health of the city of San Francisco. This is criminal. This is unforgivable, making the most vulnerable be even more vulnerable due to the inaction of the Department of Public Health, the Health Commission, and the city of San Francisco, which really has not seemed to take much interest, except at the last Board of Supervisors meeting where I was present, and I was proud to hear the Board of Supervisors call out these bodies and
Thank you.
make
Your
them
time is up.
do justice. Thank you.
Okay, that was the only public comments, the only hands I see.
Okay, thank you very much. I know that given the circumstances of the lack of policy staff available at this time, we have received a number of responses to the comments and questions that were presented earlier, and I know that it's not comprehensive, but staff's doing their best to continue to address the number of comments or questions. I'm just going to ask at this time if there are additional comments and questions from members of the committee that we want to put on record so that they can be addressed at a later time. Commissioner Green?
Yes, thank you for this, and especially with everything going on there, we really appreciate that you were able to respond even at this level. When it comes to the admissions policies, I think one of the other things you did in this new document, if I understand it right, is to put way ahead of the priority item, the item about screening. And so I'm curious, as I read this, there are several people who are automatically excluded from Laguna Honda, people with primary psych diagnoses, restrictive restraints. As I look at this very long list, I'm wondering, and the fact you prioritized it, because I think in the original document it was put after the priority list of really, which is more about locations. Now it's ahead of that. So am I reading this right, that you are putting some limitations or respecting the concerns the public has about the wrong people ending up at Laguna? Was this change meant to convey that kind of change of approach?
I don't know if there's anybody that can answer that at this time, but Navina, do you want to take a
Yeah,
stab
yeah,
at it?
and Lucia, feel free to weigh in as well. But absolutely, Commissioner Green, Laguna Honda did take those comments brought in by the public as well as the commission and decided to reorder to make it very clear before we got to eligibility of who was not going to be eligible for Laguna Honda. So hopefully that has improved the clarity of the policy.
Thank you very much.
Commissioner Chow, do you have any additional comments or questions?
Yes, I understand the difficulty in trying to get some of the specific answers that we had asked for, and that this was a best effort quite quickly as everybody is continuing to work on the recertification effort and the surveys that are usually unannounced, and therefore I guess we're having an unannounced survey right now, which we recognize is really a problem. It seems that at least many of my comments were mostly in regards to clarification, and if we were to receive those prior to submission to the commission, if that wasn't clear enough, then perhaps the process, as I'm asking the chair, would be that we would extract those to get further clarification. As I know what you're looking for is a motion from here in order to move it towards the commission. And I can see that we could do that, trying to clarify yet then some of the other issues, and if they weren't clarified, then we would remove those and ask for the clarification at that time and have them then acted on at that time. But hopefully we would be able to get further clarification as the week goes on and there's less pressure on staff. I do think that the revision on the admission program, which is what we asked for last time on 2001, I believe accomplishes much of what we were talking about, trying to settle the fact that in the prioritization that San Francisco residents are the only ones who actually are eligible to come to Laguna Honda, and that in fact priority one speaks to the fact that if somebody really needs skilled nursing and it's not in any place that has it, that they would become the first priority, which would seem to be the most humane way of looking at this. Obviously, our second priority, being that we are a network, is that I actually support that our ability to operate both hospitals in an efficient manner says that we need to be able to move patients within our system, providing they qualify and do not have exclusions as noted by Commissioner Green in the long list. Then thirdly, it proceeds and says, this was one of our questions, that those not in a facility who are receiving skilled nursing care, and that would seem appropriate, that if somebody's getting skilled nursing care but falls into a danger of not being able to continue that care in whatever setting they have, they would, of course, be NICs. And therefore then patients otherwise who require nursing and rehab would be the fourth priority. And by removing some of the qualifiers, it's really saying that regardless of where these patients are, if they're San Franciscans, if they're at St. Francis, if they're at UC, then this would be a priority that would apply to them. So I think that does answer some of the questions we had. So from my point of view, I think that we've done that staff has done a nice job. I think this is worth trying and then having us be able to evaluate it in, say, a half year or a year to see how well this is working, and do we have some holes in which we have to resolve, or are there some unforeseen circumstances that we need to address. But I think this does address certainly our concerns here and the public's, that San Franciscans need to have access. And here it does not say San Francisco is in the city or outside the city. So all of these would have the ability to either be repatriated if they fall within our categories, and or else even having landed elsewhere for acute illness, be able to come back. So I think it does answer very well how Laguna will be serving our public. So I'm satisfied with where Anne could also then recommend that from my perspective to the full commission.
Okay. Thank you for your comments, and I think that given the overwhelming concern about the admissions policy that's been expressed both by the public and members of the commission, we do appreciate the effort on the part of Laguna Honda staff to address those, and we know nothing's going to be perfect. Even as we will test out this and other policies. And so we do hope to be able to gather the appropriate amount of data in the appropriate amount of time, so that if there is anything that continues to be a concern in the future, notwithstanding that these policies and procedures will have been passed, that we will be able to revisit them in a stated amount of time with the appropriate data and input from both the public and the commission, so that we can continue to improve all of those policies and procedures, the massive number, both in terms of the recertification effort as well as the phase 3 regulations, and then just some ongoing needs. And so again, appreciate all the effort. We know that there's going to be another fairly large packet of policies, I'm assuming, coming in September. But for the moment, as Commissioner Chow has said, unless there is a lack of clarification on those that can be clarified prior to the commission meeting, the full commission meeting next week, it would seem appropriate that we would ask for a recommendation to go ahead and recommend these policies to be approved by the full commission. Again, we'll await any further clarification and detail pending that actual vote for the full commission. So in the meantime, if I could have a motion to make a recommendation to the full commission.
I would so move that we forward these recommendations for approval to the Health Commission, and with the caveat that if the request for a certain clarification has not occurred, that we would then extract those.
Second.
Okay. All those in favor?
Aye.
Aye. Okay.
Great, thank you very much. And those from the public who made comment. Item 8 is a consideration for a closed session. And the first part of that is taking public comment on that item. Just want to check to see if anyone has public comment. I see 3 hands. Again, those who've received accommodation for disabilities will be prioritized. Caller, I've unmuted you. Please let us know that you're there.
It's Patrick. Can you hear me, Mark?
Yes, please begin.
Okay, I'm a little concerned that this closed session is involving a quality improvement closure plan update being presented by Troy Williams. It's unforgivable that the 60-day reform plan that Troy Williams and Dr. Colfax developed in June 2019 as a follow-up to the sexual abuse scandal, which led to Laguna Honda's eventual decertification 3 years later, that if Mr. Williams is presenting the California Department of Public Health closure plan that was supposed to be submitted on July 31st, and you're going to discuss that in closed session today, that when you come out of closed session, you should take a vote and release whatever it is that Mr. Williams presents about that state closure plan. Thank you.
Thank you. All right, I see another hand. Caller, please let us know that you're there.
Hi, it's Dr. Palmer.
Yes,
Can you
please
hear me?
begin. Yes.
Yeah, no, the public needs to know what the closure plan is, and we're skating pretty close to the line here, and the families of patients and the public need
Dr.
to
Palmer,
know
Dr. Palmer, this
closure
issue,
plan.
this item is about closed session.
Yeah, well, we're assuming that you're going to cover that in closed session, and we do urge you, in the interest of transparency, to release those details of the state closure plan to the public if they are covered in closed session. Thank you.
Thank you. And one more. And again, this public comment should be about the closed session. All right, please let us know that you're there.
Yes, I'm there, and I agree with Dr. Palmer that we want to know what is discussed in closed session regarding the future of potential closure of Laguna Honda Hospital. And again, I'm speaking for the Harvey Milk LGBTQ Democratic Club, and we are also going to be raising this with the larger Democratic Party in San Francisco, because this is a situation that needs to be monitored. And in the future, when all of this is somehow resolved, there needs to be more oversight to this process. Thank you.
All right, thank you very much. Those are the only public comments on this item. And so, commissioners, at this time, please consider a motion to go into closed session.
So moved.
Second.
All those in favor?
Aye.
Thank you.
All right, members of the public, while the commissioners are in closed session, you will not hear or see us, but we will be back. You're welcome to stay. Thank you very much for all your participation. Give me 30 seconds to move us over, please. Open session. Commissioners, please consider a motion to disclose or not disclose discussions held in closed session.
Move not to disclose.
Second.
All those in favor?
Aye.
Aye.
And now a consideration for adjournment.
I move adjournment.
Second.
Okay. All those in favor?
Aye.
All right, please give me a minute to shut us down. And thank you everyone for attending and for your comments. We do hear you.